Hi, students. Today we are going to cover Chapter 9. And Chapter 9 covers fluid and electrolyte balance, and we'll start with water. Water makes up around 2/3 of our body weight. It is the most abundant molecule in our body, and some would consider it the most essential of the nutrients because without water, we would perish within a few days to a week, where it takes much longer for the other nutrients. Here you can see a comparison of the main constituents of the body, and you can see clearly how water factors in. And now to the functions of water. Water has many roles, vital roles for the body, and we're going to quickly cover them. Be sure to read through carefully in your textbook. It's a universal solvent, so it dissolves substances and therefore transports nutrients and waste around the body. It's the primary component of both blood and lymph. That's important as well. And we do make some metabolic water, about 1 cup or more per day, through chemical reactions. Water transports nutrients and waste, as I mentioned. And I do want to focus on this slide for just a few minutes because it has some relevance to water need. When we consume more protein than our bodies need, we need to dismantle that protein and get rid of the nitrogen because the rest of it can be used for fuel or turned into fat. That process is done by the liver and it's called deamination. The liver removes the nitrogen, becomes ammonia, turns the ammonia into urea, and sends that urea out into the bloodstream to head to the kidneys. That urea is an extra solute that pulls in fluid. So if you're on a very high protein diet, well above your needs, you need to make sure to drink enough water, to drink extra water because of that. We see the same thing with sodium. Excess sodium, you consume a pizza and some French fries, most of that sodium is absorbed, ends up in your bloodstream, and then pulls in fluid to be excreted with the sodium in the urine. So you need to make sure you increase your fluid consumption as well. And typically you do because you feel thirsty. But when we talk about urine output, we need to keep in mind that it depends on how much fluid you consume, how much protein, and how much sodium. We know that water contributes to our body temperature regulation. When we perspire, that evaporates through the skin and carries away heat energy. Water is also important in moistening and lubricating and cushioning. And in fact, when someone is dehydrated, you feel a dry mouth because of that. When children have a diarrheal illness, nurses ask about tear production. When they're crying, do you see tears? Because if it's severe dehydration, we can see an impact there. As far as water intake, we've widely used the rule or 8 cups of water per day, but this is certainly not perfect because water needs vary so dramatically depending upon your life situation. So let's look at the adequate intake for water. It is 11 cups, food and fluid, and that translates to about 9 cups of fluid alone. And for men, it's 15 cups food and fluid, and that translates to about 13 cups. So food does give you some fluid as well, some water as well. So we can count that in, but it's not a whole lot for most people, okay? So about 9 cups for women, 13 cups for men. And I did want to mention, when we talk about water, we also include all of your beverages, your milk and your tea and your coffee and your sodas and even your alcoholic beverages. Those all contain mostly water. So we do count them in. What's important health-wise, of course, is the balance between the in and the out. The in being the food and the fluid and that little bit of metabolic water, and the out being urine, skin, lung, and feces. Anytime there's a dramatic shift, less in or more out, we run the risk of water imbalance. So if you, and I've had this, I've asked students through the years, has anyone been dehydrated? And the situations in which students recall, one is being in a hot climate and just not consuming enough fluid. So their intake wasn't adequate and they were perspiring more. The other is an illness where there's water loss through a diarrheal illness, so more lost in the feces as well. You can also imagine that if you were on a medication that caused increased urine production, you could run the risk of being dehydrated as well. Foods and fluids, but note that these foods give a bit of water. Fruits and vegetables are significant. Something like rice is significant. But again, most of your water needs come from fluids. Do look over the fluid balance and how our bodies maintain that fluid balance. It's really interesting. It involves the brain and it involves the kidneys. It involves the blood. When there's less fluid in the blood, the brain receives signals, and then the end product of the signal and then the hormones that are produced is that the kidneys retain more water. The kidneys themselves sense decreased blood flow, and they retain more water as a reaction to that as well. So what we see is if you don't consume enough fluid to meet your needs, the kidneys hold on to more and your urine becomes darker. It becomes more odoriferous, a stronger odor, and it becomes scant or less in volume. We're very concerned when there's less than 2 cups of urine production, because that means that things are very much out of balance, because we need about 2 cups at a minimum to get rid of the waste that's required by the kidneys. So you can take a peek at this chart that shows you how dehydration progresses, but I wanted to look at this video right here very quickly.
Body odor, bad breath, flatulence. Is your body telling you?
Every living organism we know of requires water to survive. It's part of the reason we look so feverishly for water on other planets across the universe and consume it consistently every day here on Earth. So what would happen to your body if you stopped drinking water? Of course, when we say water, we're including all fluids which simply contain water, like juices, pop, or tea. Much like the desire to breathe in oxygen, thirst is a survival instinct. H2O is the most abundant molecule in the human body, making up, on average, 65% of an adult. As a universal solvent, it carries nutrients and hormones through the body, regulates body temperature, cushions our joints, and even lubricates our eyes. You produce around 1.5 liters of urine every day, with another liter lost from breathing, sweating, and pooping. So it's essential that the body replaces this liquid. The thirst center of the brain is located in the hypothalamus and is constantly using sensors in your blood vessels to monitor the amount of sodium and other substances in your body. For example, if you sweat too much, your blood volume and pressure fall. The brain then detects this change and creates the urge to drink something now. So what happens if you're unable to satisfy this thirst? The initial signs of dehydration are the obvious dry mouth, following which your urine becomes darker with a stronger odor as your body attempts to conserve more fluids. The lack of H2O then begins to affect your brain. You might feel lightheaded, have a slower response time, and decreased ability to feel pain. In fact, when you're dehydrated, your brain tissue literally shrinks. In studies observing hydrated versus dehydrated participants, the same task required more brain power and oxygen in dehydrated individuals compared to those fully hydrated. After a day or two with no fluids, you'll stop peeing altogether, have trouble swallowing, suffer from muscle spasms, and likely experience nausea. After all, your body can survive without food much longer, and attention to digestion is not a priority at this point. Eventually, victims may become delirious with severely impaired brain function. Interestingly, studies looking at elderly patients who suffer from delirium found that many are simply suffering from chronic dehydration in the first place. After even more time without water, the blood stops flowing to your skin, reducing heat loss but increasing your core body temperature. This can lead to a gray-bluish tinge to your skin. Beyond 3 to 5 days without water, and your body will begin to shut down its organs and eventually the brain. Of course, unlike the plentiful oxygen we breathe, only 2.5% of all Earth's water is fresh, most of which is locked up in glaciers, ice caps, and underground lakes known as aquifers, leaving less than 1% available for drinking. And most of this water is actually used to grow crops. Approximately 500 billion liters of fresh water is used daily for agriculture in the USA alone, with another 500 billion liters to cool electric power plants. And as our personal drinking sources become increasingly contaminated, over 783 million people on Earth are unable to access clean water. Scientists around the world are trying to find solutions to this problem, from attempts to remove salt from the ocean water, tap into underground aquifers, and creating innovative water filtration systems. If we look to space, NASA has developed technology for astronauts to turn their urine into water more pure than what we drink on Earth. But we can't just rely on science and technology. Perhaps the solution relies on us as a species to understand and contribute to this global water crisis. If you want to help in the mission to end global thirst, join in World Water Day on March 22nd.
Okay, so here we are. Can we rely on thirst? Thirst is a fairly good indicator, but it's certainly not perfect, and it can lag behind dehydration in certain situations. First of all, older people have a decreased thirst sensation. So that's one situation. When individuals are ill, when they're exercising, especially heavily. So for athletes, for instance, they need to know that they should hydrate before, during, and after exercise, and they need to make up for any lost body weight from before to after with 2 to 3 cups of fluid for each pound. For children and infants, we watch them very closely when they're losing more fluid than normally through an illness and vomiting and diarrhea. Can a person consume too much? The answer is yes, although it's rather difficult to do. You can overwhelm your kidney's ability to excrete the extra fluid. And that would typically occur when someone's consuming just a crazy amount of fluid in a short period of time, or when athletes are exercising or competing in an endurance event. And as we talked about previously, are replacing fluid but not electrolytes. So hyponatremia then occurs. Okay, so onward. As far as electrolytes that do their work in the fluids of the body, we talk about 4, the sodium and chloride, extracellular ions, and intracellular being potassium and phosphate. So what we're talking about here is that the fluid in the body is in different spaces, and that's important to understand because at times, and sometimes involving these electrolytes, fluid moves from one space to another. And you can see here that the solute concentration is important in the movement of the fluid. As far as electrolytes and nerve function, what we see happening in the nerve cells is the movement of sodium out and potassium in, and then a slightly negative charge is within the cell, but when sodium moves into the cell, then we see the change in the charge, and all of that is important in nerve conduction. Electrolytes are important also for maintaining pH where it should be. A normal extracellular pH is 7.4. We will talk about buffers shortly, but electrolytes do aid in maintenance of this acid-base balance. When pH is off, either direction, This can be very, very dangerous. And in acidosis, we see that the body accumulates too much acid. The client can become disoriented and fatigued. And this is something that you will see in poorly controlled diabetes, starvation, diarrhea, in even some lung disorders as well. In alkalosis, we see the body loses too much acid. The client becomes agitated and dizzy, and this can occur with vomiting, in altitude sickness, and diuretic use as well. So buffers are very important for the body to maintain pH where pH should be. Proteins can act as buffers. The respiratory system is important for maintaining the proper pH, and electrolytes function in the kidneys. All right, so now let's talk about these major minerals. We'll start with sodium. Sodium is 40% of table salt, which is sodium chloride. A teaspoon of table salt is a little bit more than the sodium allowance or limit for the day. We talk about 2,300 milligram maximum for the amount of sodium that we should consume. It's important to understand, though, that most of the sodium that we consume is not added by us. So sometimes clients have the incorrect impression that they get to add a teaspoon of salt to their food a day and they'll stay under these limits, but that's not true. And we'll look at that shortly. Sodium is very abundant in the food supply, and most Americans exceed the requirements. It does have function, so we do need sodium. Okay, we do need sodium. Sometimes experts say at least 500 milligrams a day. The adequate intake is about 1,500 milligrams a day. We absorb it freely, of course, and then feel thirsty and drink and excrete the extra. Sodium adds pleasure to food. You know, we like the flavor, and it's also important as a preservative. And we've talked about, you'll see this common theme throughout, that it's important for nerve impulse conduction and also for fluid balance as well. So as far as deficiency, you wouldn't think this would occur with so many people consuming so much sodium, but it does. Sometimes people just consume very little, and this causes a problem. More frequently, it's due to excessive perspiration. And some individuals do not only perspire a lot because of their work or their sport, but also they lose a lot of sodium in their perspiration. Many years ago, I was told, if your sweaty t-shirt dries and you see this powdery residue, you're a heavy sodium sweater and you need to make sure that you attend to this. When my children were swimming in high school many years ago, there was a young athlete that kept cramping up during his events. Went to the doctor, found out that he actually had low sodium levels, and the remedy for that was for him to drink some pickle juice before he competed. So you can see muscle cramps, nausea, vomiting, dizziness are all symptoms of low sodium. Now, most of us get far too much, as I mentioned, and it's very, very important to understand that most of the sodium comes in through the food that has been prepared for us. So during manufacturing, the ultra-processed food, the restaurant food, 77%. And keep that in mind when you work with your patients, because quite often they will say, well, we put the salt shaker away, we're good. But that's a step, okay? But that's not good. You need to look at all of the foods, the packages, the bags, the drive-throughs. All of that is very, very important. We're consuming much more than is recommended as a maximum. The foods that are high in sodium tend to be the ultra-processed foods and the restaurant foods. And we see the whole foods, lightly processed, unprocessed, as being low in sodium. We see the same in this chart here. If you look through each category, you can see a tremendous difference between the foods that are processed within that group and the foods that are less processed or unprocessed. Take a minute to check out these numbers. So it is important to avoid too much sodium, even, by the way, if your blood pressure is normal. And this is the reason. Not only does it lead to dehydration, but over time it will lead to an increased blood pressure because sodium seems to have an impact on the health of your blood vessels. Over time, on a high sodium diet, your blood vessels will become less able to relax, okay, have less give and take, and that increases blood pressure. High sodium foods are often high in calories and unhealthy fats and added sugars, so that they are linked to overweight and obesity as well. Okay, so as far as choosing the best salt, it is really important to understand that all of these salts are salt and all contain about the same amount of sodium. They're different in terms of their taste. Sea salt has some minerals, kosher salt has bigger granules, it's chunkier, and table salt is typically fortified with iodine. But as far as sodium per milligram, they are about the same. They all come under the same limits. I did want to mention one other thing. I was looking for it in the slides, but it must be in the textbook. And that is, when you cut down on sodium, it takes a while for your taste buds to adjust. Your textbook says 8 weeks. I had always heard at least 4 weeks. But what this means is you need to be a bit patient and really flavor up your foods with other things like garlic and herbs and spices that are sodium free. Because if you don't, your food will taste very bland. After 4 to 8 weeks, what will happen is that your taste buds will spring back and you will start tasting the flavors that have been overwhelmed by sodium in the high sodium diet. All right, on to potassium. You can see here fluid balance, nerve impulse transmission. Okay, so the theme continues. But what's different with potassium is that it helps lower blood pressure. And the dietary guidelines believe it's a nutrient of concern. We're not getting enough potassium. Where do you find it? Here's a list: vegetables, fruits, beans, whole grains, dairy, fortified soy. It's very important to understand that bananas are a source, but not the best source and not the only source. Many high sodium, high potassium fruits, vegetables, etc. Low blood potassium is called hypokalemia. We see that in bulimia, we see that in chronic diarrhea, very low calorie diets, and it can cause a number of symptoms, including an irregular heartbeat. So to get enough potassium, you need to make sure that you consume all of these wonderful, healthy, plant-based foods. Okay, so you see a lot of them here. What's important to keep in mind is that an ultra-processed food diet is high in sodium and low in potassium. And the reverse is true of a whole food plant-based diet. Okay, so they are high in potassium and low in sodium. So here you go, not just bananas. Bananas are a source, but we're really doing our clients a disservice if we tell them eat a banana because you're on a potassium wasting diuretic, when there are so many other good sources. By the way, orange juice is a great source of potassium. Here it is at the bottom. Here you go with more. And on to chloride. So functions sound very familiar again, but we've added immune response and deficiency. We can see that with these major minerals, Extraordinary losses from things like vomiting and diarrhea seem to be the major cause of deficiency. Chloride deficiency is not very common because we consume so much salt. Getting enough chloride again is fairly easy because we consume so much salt as well. Now, finally, I want to talk a little bit about hypertension, which is extremely common. From 1 in 3 to 1 in 2 Americans has high blood pressure. I had heard that when they made the last changes to the designation, we were closer to 1 in 2. But regardless, it's a lot of Americans. And what's interesting about hypertension is the impact over time can be decreased or eliminated if we just manage this disease. Now, it's called silent for a reason. This says silent disease. I had often heard silent killer, but the reason is that you usually do not have symptoms when your blood pressure is high. Okay, that's another myth. Most people can walk around with very high blood pressure without any symptoms. So here are the kind of newer designations. What's very important for your test is to understand that normal is under 120/80, not 120/80 and under, less than. Okay. In the elevated range, 120 to 129, and less than 80 for the diastolic, in the elevated range, lifestyle should be used. And we're going to talk about that. And then when it moves up to stage 1 and stage 2, typically medication is added. It really is good practice, though, to try lifestyle for a couple of months to see if it has an impact and eliminates the need for medication, especially at these lower levels. It is important, as I mentioned, to manage blood pressure because blood pressure is connected to so many diseases, and you see them here. It's not just heart disease, it's not just stroke, it's kidney disease, it's brain function as well, and cognitive decline in aging, it's vision, it's sudden death. And it's also important to understand the significance of the risk factors and the relative significance. Really important. So yes, family history, you can't do anything about that, and that plays a part. Yes, aging, and we're all going to age, right? But look at the number 1 factor there. It's excess body fat and obesity, okay? The number 2, inactivity. The number 3, too much alcohol. The number 4, too much sodium. First of all, notice that too much sodium is not on the top of the list. Secondly, notice that these are all lifestyle changes that have the highest on the list here. African Americans and Asian Americans do have a higher risk than Caucasians, so we will note that. I also want to mention that calcium, potassium, and magnesium have a positive effect on lowering blood pressure, especially among African Americans. Magnesium and calcium can help blood vessels relax. And this is really important because when we look at the DASH diet, the DASH diet is moderately low in sodium, but more, it's rich in calcium, potassium, and magnesium. Okay, it's what the minerals we're adding to the diet that seems to be so important. And you can see here per day, lots of fruits and vegetables. Okay, that's my goal every day. And I'm not sure I always meet this, but I really do try. So this takes some work for most Americans, as well as the 2 to 3 servings of low fat or fat-free dairy. We're not here. Okay, we typically do well with grains and certainly with meats. In fact, we need to eat a little less of that. But this area that's so important for providing those minerals that we need to lower our blood pressure, we're not meeting. So I love this chart in your textbook because again, it shows the impact of each different step that's part of this kind of holistic plan to manage or lower blood pressure. So let's look at this. The biggest impact is from losing weight. For every 20 pounds, 5 to 20 points. And why this is so important is not only because it has the largest impact, but also because you don't have to lose the 80 pounds that you need or your client needs. 20 pounds has a significant effect. The DASH eating plan is next. So what we add, right? Not just low in sodium. Exercise is next, and then limiting sodium. So one of my pet peeves is doctors who write the prescription for the medication and say, eat a banana and watch the salt. That is not adequate. It's not adequate in talking about where sodium is found in the diet. It's not adequate in talking about the many sources of potassium, but it doesn't address all of this that's so important for lowering blood pressure. Okay, thank you.